Welcome to Smart Wellness Tips, where we uncover vital health secrets that could save your life or the life of a loved one. Today, we discuss a silent killer that strikes without warning, changing lives forever in the blink of an eye: the sudden stroke. A stroke does not always announce itself with dramatic pain or an immediate collapse, making it incredibly dangerous for the unsuspecting victim. It often begins with a sensation that feels just a little strange, leading people to believe they simply need to rest momentarily. This false sense of security is the enemy, because ignoring these subtle early signs can lead to permanent disability or tragic death. Imagine a ticking clock inside your brain, where every single passing minute results in the tragic death of 2 million brain cells. That is the terrifying reality of a stroke in progress. Your brain is literally starving for oxygen with every second that passes. The delay in seeking help is usually not caused by carelessness, but because the initial symptoms are often too mild to notice. You might notice a slight droop in your face or a bit of numbness, yet convince yourself it is nothing serious. In the medical world, the saying is time is brain, meaning that every second delayed destroys the intricate connections of your mind. Once those millions of brain cells die, they do not regenerate, meaning the functions they controlled are lost to you forever. This could mean losing the ability to speak clearly, the power to walk, or even the simple joy of holding your grandchildren. Let us consider the tragic story of Frank, a 72-year-old man who woke up one morning feeling just a little bit clumsy. While he was shaving, his hand simply would not cooperate, causing him to drop his razor into the sink multiple times. He tried to speak to his wife, but his words came out slightly slurred, yet he dismissed it as just being tired. Instead of calling for an ambulance immediately, Frank decided to lie down, hoping the strange feeling would pass after a short nap. He waited 2 full hours before finally admitting something was wrong, but by then, the damage to his brain was already extensive. When he finally arrived at the hospital, the doctors discovered that a significant portion of his brain tissue had already been destroyed. Because of that 2-hour delay, Frank lost his independence, can no longer drive his car, and requires daily assistance for basic tasks. Frank's story is a heartbreaking reminder that waiting to see if you get better is the worst decision you can make. This brings us to the most important concept in stroke survival, known by medical professionals worldwide as the critical golden window. This window is a period of approximately 4 to 4.5 hours from the very first moment symptoms appear. Within this short time frame, doctors can administer powerful clot-busting drugs that can dissolve the blockage and restore blood flow to the brain. If treated within this window, the brain tissue that was suffocating can often be saved, preventing long-term paralysis or severe disability. However, once this golden window closes, these miracle treatments become ineffective and can even be dangerous, increasing the risk of bleeding. Arriving late means doctors have fewer options to help you, and the focus shifts from curing the stroke to managing the damage. This is why recognizing the symptoms immediately is not just important, it is the only way to ensure a full recovery. You must memorize the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services immediately without hesitation. Arm weakness often manifests subtly. You might try to raise both arms, but one drifts downward uncontrollably due to muscle failure. Speech difficulty can be confusing. The person might look awake, but speak in jumbled nonsense, or be unable to speak at all. Face drooping is easier to spot. Ask the person to smile, and if their smile looks uneven, it is a red flag. If you see any one of these signs, do not wait to see if they improve, because they almost certainly will not. A common mistake is giving the patient water or aspirin, which can cause choking or worsen bleeding if the stroke is hemorrhagic. Do not let the person sleep it off. Unconsciousness during a stroke is a sign of severe brain trauma, not natural sleep. Another critical error people make is driving themselves or their loved ones to the hospital instead of calling for an ambulance. Driving yourself is incredibly dangerous because the patient's condition can deteriorate rapidly, leading to an accident on the way to help. Paramedics can begin life-saving treatment the moment they arrive at your door, effectively bringing the hospital's emergency room to you. More importantly, the ambulance crew notifies the hospital in advance, triggering a stroke alert that clears the way for immediate action. This pre-notification allows you to skip the waiting room and go straight to the brain scanner, saving precious minutes that save brain cells. When you drive yourself, you arrive as a stranger and must wait for triage, losing the critical advantage of the hospital's preparation. Frank drove himself, and by the time he parked and checked in, he had lost the opportunity for the best possible recovery. For family members, the instinct is to comfort your loved one and tell them everything will be okay if they just rest. You must fight this instinct. The most loving thing you can do is to ignore their protests and call for help immediately. Do not accept their excuses that they are just tired or had a bad meal. Stroke denial is a very common symptom. Your decisive action is the only thing standing between your loved one and a life of severe disability or dependency on others. Statistics show that someone suffers a stroke every 40 seconds, making it one of the leading causes of disability in the world. While we cannot predict every stroke, knowing how to react when it happens is a survival skill everyone over 60 must have. Prevention is also key. High blood pressure is the biggest risk factor, so monitoring it regularly can drastically reduce your personal risk. Maintaining a diet low in salt and rich in vegetables helps keep your blood vessels healthy and resilient against potential blockages. Smoking thickens your blood and increases plaque buildup in arteries, so quitting is the single best gift you can give your brain. Just 30 minutes of moderate walking every day can significantly improve your circulation and lower the likelihood of suffering a stroke. If your doctor has prescribed medication for hypertension or cholesterol, taking it exactly as directed is non-negotiable for your safety. Be aware of mini-strokes, which are temporary blockages that resolve themselves but serve as a major warning sign of a future attack. Never ignore a mini-stroke just because the symptoms disappeared. Treat it as an emergency to prevent a major catastrophe later on. Your life is precious to your family, and protecting your health allows you to create many more beautiful memories with them. Let us remember the FAST rule one more time. Face, arm, speech, and time are your tools to defeat this silent enemy. Program the emergency number into your phone and teach your grandchildren how to call for help if they see you unwell. Educating the younger generation about these signs creates a safety net around you, ensuring help is never too far away. Recovery is possible with hard work, but prevention and early detection are always superior to the difficult road of rehabilitation. Medical science has advanced incredibly, giving us tools to save lives that would have been lost just a few decades ago. Use technology to your advantage. Smartwatches and health monitors can alert you to irregularities in your heart rate before you feel them. Protecting your brain is protecting your essence, your memories, your personality, and everything that makes you who you are. If Frank had called immediately, he might still be driving his car today, enjoying his retirement instead of being confined indoors. Do not worry about bothering the doctors or feeling embarrassed if it turns out to be a false alarm. Safety comes first. Doctors would much rather send you home healthy after a false alarm than treat you for a massive stroke that arrived too late. Be especially vigilant during colder months or sudden temperature changes, as these conditions can constrict blood vessels and increase blood pressure. Staying hydrated is a simple yet effective way to keep your blood viscosity normal, reducing the strain on your circulatory system. Commit to a comprehensive medical checkup at least every 6 months to catch any silent risk factors before they become emergencies. Share this knowledge with your friends and community groups. Becoming a health advocate can save the lives of those around you. Remember, time is brain, denial is dangerous, and the ambulance is your fastest route to the treatment that can save you. Listen to your body, trust your instincts, and never hesitate to demand emergency care when you feel something is not right. We urge you to share this video with everyone you know over the age of 60. It is a vital survival guide. Subscribe to our channel for more life-saving health tips and expert advice designed to keep you living your best life. We wish you and your family abundant health, safety, and the wisdom to act quickly in times of medical crisis. Thank you for watching Smart Wellness Tips. Please take care of yourself, and we will see you in the next video.